Hi there folks, this is Matt Scalise, Doctor of Physical Therapy, McKenzie Spine Rehab Specialist, and Orthopedic Certified Specialist. This is part 2 of a 2-part discussion on the lumbar disc and its role in your back-related problems. In part 1 we talked about the anatomy and function of the disc, and now in part 2 we will expand upon that role. When one who suffers with some back-related problems seeks attention from a medical professional, very often during the discussion with that medical professional, terms like disc bulge, disc herniation, facet arthritis, sacroiliac joint dysfunction, spinal stenosis, terms like that are bantered about as a possible cause of one's back-related problems. Patients often come away from that discussion very dizzied and confused as to what is the true source of their back-related problem. Well, the story of someone suffering with disc-related problems, the signs and symptoms are uniquely different from the signs and symptoms in the story of someone who has spinal stenosis or facet arthritis. So let's focus on the common signs and symptoms of disc-related problems and focus in on the common story that we hear. So in part 1 we talked about how the gel-like substance within the disc has the potential of forming a disc bulge. When day-to-day activities are taking place in the presence of a disc bulge, pain will occur. If that same day-to-day activity is taking place with equal distribution within the disc, there will be no pain. So patients with disc-related problems often describe a frustration with pain occurring with one activity on one day and then repeat it at some point later without any complaints of pain at all. So the first thing to remember with disc-related problems is the inconsistency of the presentation. The second thing to remember is the pain that one experiences very often with both sitting and with bending forward. Remember back in part 1 we talked about how in those situations the disc is very often put into a precarious, bulged position. The next thing we want to talk about is a common complaint of people having difficulty rising from a seated position. And there's a correlation that 30 minutes of sitting creates more pain upon rising than after just 5 minutes of sitting. Let's explain further. When you sit initially, there's equilibrium within the disc. The longer we sit into a slouched position, that provides a greater and greater opportunity for the jelly-like substance to migrate towards the back. When we then attempt to straighten up out of that position, the disc can't so easily accommodate. So there's that pressure in the low back, and one looks like an older fellow when they try to get up out of that seated position. And it may take a few steps or a few minutes before someone is able to right themselves completely. Another common complaint that we hear with sufferers of disc-related problems is that if the disc bulge is significant enough, they will describe a day or two during their history where they were stuck in this position, either forward bent or listing off to the side. In those situations, the disc bulge again is so significant that righting themselves and rocking over that disc bulge is too painful. And they just would rather follow the path of least resistance and just keep themselves in this position or keep themselves in this forward bent position. Another interesting phenomena related to disc-related problems is increased pain in the morning and the first few hours upon rising after sleep. Let's explain further. As we lay horizontal, the body and the discs specifically have the ability to absorb water. So we are actually slightly taller in the morning than at later times during the day. With extra water content within the disc brings extra pressure. With extra pressure, it brings extra pain, as we do our day-to-day activities. So patients often notice terrible pain putting their socks on in the morning, with much greater ease removing the socks in the evening time. Just like people have increased pain with sitting slouched or bending forward, people often find relief when they stand and walk if their problem is related to the disc. And that is because walking and standing very often equally distributes the gel within the disc. Patients describe scenarios where they can often walk their symptoms away. And lastly, because this gel-like substance has the ability to move and to create greater amounts of a bulge than at other times, and has the ability to sometimes press on a nerve and at other times be away from the nerve, patients with disc-related problems could have pain in their back, their butt, all the way down into their foot. And there could be patchiness. It could be only in the foot, it could be only in the buttock area, or it could be in one continuous line. So, if some of the things that I have described sound familiar to you, chances are you are having pain or symptoms related to disc problems. If they are all too unfamiliar with you, then the chances are you are suffering from some other source of a back-related problem. Once again, this is Matt Scalise, Doctor of Physical Therapy, speaking on behalf of the Global Exercise Group.